See, last class I think we have seen super male. So we have super female, Turner syndrome, and intersex. So tell me the side headings here. Super female, also known as triple X syndrome. So what are the side headings? Type. So after type, so what is the type of chromosomal aberration? Allosomal, numerical, chromosomal aberration, isn't it? Then after type it is karyotype. So what is the karyotype? Here you have type 1. Type 1 is you have 46 chromosomes arranged in 44 plus triple X, or 22 pairs plus triple X. Then type 2, you have 47. So 44 and 3, 47. This is 48. 44 plus 4x, or 22 pairs plus 4x. Type 3, this is rare. So after karyotype, what is the next side heading? Not what genotype? You did not attend this class. So after karyotype, it is I want to maintain the consistency. So what is the side heading, online students? After karyotype, patients, causes, then frequency, lifespan, frequency. Okay, then next one is frequency. So next one is frequency. So frequency is 1 in 1000 female live births. Then after lifespan, what is it? Sorry, after frequency. After frequency, patients, then lifespan. Patients are female. Patients are female. Lifespan. Lifespan is normal. Then after lifespan, causes. Causes. Late age pregnancy, then you have abnormal meiosis. So in abnormal meiosis you have non-disjunction of chromosomes and self duplication of chromosomes. During cell division. Then after causes, symptoms. After causes, symptoms. Symptoms are general symptoms, for all allosomal. What are the general symptoms? Hormonal imbalance. Because of hormonal imbalance, tremendous psychological stress or pressure. As a result, learning issues, and behavioral issues. Yes.
So what will be the second one? How, like stress? There will be stress also.
Stress. Then after general symptoms, it is specific symptoms, isn't it? Right now?
What is it called? Here.
Learning issues and behavioral issues. Specific symptoms. The specific symptoms because of addition of an X chromosome they may grow tall. Prominent feminine characteristics. They are perfectly fertile. Then diagnosis.
So they grow. Second one.
They may grow tall. Next one, diagnosis. For diagnosis, we have written karyotype analysis. So this karyotype analysis can be done in prenatal stage or postnatal stage. Treatment not required. For all these, treatment is not available. We are maintaining consistency, so we will write not available and not required. Prevention. Prevention is prevent late age pregnancy.